might be our second live in the last 30 seconds, but welcome back to Healthy Hump Day, guys. My name is Dr. Donald Miller, and this is Dr. Shannyn Pearce. I'm getting the topic right, so we're not stressed out about me saying the right thing, so we're getting there. Guys, today's topic, it's a big one. We're going to be talking about brain fog. So what is brain fog, right? A lot of people call it brain fatigue, and so... Yeah, right.
Go ahead.
And so, it can range from a mild case to a severe case of mental confusion, right? So kind of mid-sentence, you forget what you're talking about. You go to call somebody and you forget who you were going to call. You kind of just find yourself, your mind trailing off, confusion, concentration becomes an issue. And so this is what we call brain fog. And at the end of the day, it's really caused mainly from inflammation. Inflammation loves to go to the brain and store in the brain, just like it likes to go to your joints and muscles. And so some other symptoms of the brain fog, or some other symptoms of this happening, are things like confusion, irritability, not being able to sleep really good, getting some, either just mild headaches, or they can even be more severe headaches, just a decrease in energy, like no motivation, right? It's just all telling us that brain just isn't really functioning optimally and something else is going on, right?
Yeah. And I see this in a lot, especially my female patients, but definitely some men too. And I had it myself when I was dealing with all my hormone issues. It just feels like your brain is really overwhelmed all the time. So I used to find it really hard to multitask. Or like if I was trying to do something and someone was talking to me, not only could I not compute it, it would actually get me very anxious because my brain couldn't keep up with it. And I hear a lot of women say the same thing, that it's just really frustrating and it's kind of scary because we see things like Alzheimer's and dementia so much on the rise. When you start seeing your mental acuity get worse, of course that's the first thing you're going to think of is, oh my goodness, something really bad is happening. And it is. That brain fog is a really big sign that something else is going on. And like so many things that we see here at the Wellness Way, it's hard to tell what exact thing is causing it unless you do the right testing. So what we want to do today is walk you through the main things that can cause that brain fog and give you a few tips to start maybe minimizing some of that right off the bat. But nothing's going to take place of the proper testing that will really get down to the bottom of why your brain is getting that inflammation and having, those troubles remembering things. So
Absolutely. So some of the conditions that I see, right? I see a lot of diabetics, a lot of people with different metabolic disorders. And so, with a lot of these issues, obviously there's a ton of inflammation, right? And I know, it's like, well, they always talk about inflammation and, yes, inflammation is very, very important, but again, we test to find out where the inflammation is coming from. And so, for all you diabetics watching this video, all you diabetics are diabetic for a little bit different reason, okay? And so there is no cookie cutter approach that's going to reverse diabetes.
Right.
You need to be tested to find out what organs aren't functioning properly, what hormone imbalances you have, what nutritional deficiencies you're dealing with. Do you have food allergies? Do you have GI infections? What exactly is driving those inflammatory processes in your body that's causing that inflammation to go to your brain? Because again, the inflammation likes to go to your brain, your joints, and your muscles for the most part, right? And so we see these sick people that are coming in here. A lot of people come in here originally for chiropractic care because they're in chronic pain, and not always will an adjustment by itself take that pain away, right? And it's like, well, I came to get rid of pain and the adjustments are not working all the way. And again, it's because you've got metabolic reasons why the inflammation is there. So if we don't address those issues, there's a lot of people after that they come and get adjusted for headaches. The headaches go away, immediately. And that's amazing and that's awesome. And we can't take away the power of the chiropractic adjustment. But for those people that are not getting the benefit or not getting the results from just an adjustment, there's more underlying issues, right? And so we need to find out what those are.
I think that's huge to say. We talk about this in our inflammation talk. Good?
Excuse me.
Yeah?
Guess what?
We talk about this in our inflammation talk often, is we have three sources of that inflammation, and it's traumas, thoughts, and toxins. And trauma is a huge piece of that, and that is what a chiropractor addresses, and we see it all the time. Again, my story as a child was I had migraines, horrible, for years and years and years. I had one chiropractic adjustment, and my migraines left for the most part of my life. But then you get a lot of people that doesn't happen, and again, just because that might not be your specific issue, but it is going to be a big piece of your issue because your nervous system is paramount. It controls everything. So we always have to start there, but then figure out what else is going on. So another main reason we find in people who have brain fog is some low functioning thyroid. So there's actually a lot of research that shows that the T3 component of your thyroid hormone, so your thyroid actually makes 6 different hormones, but the T3 hormone is the one that is the most powerful for how your body runs its metabolism and makes energy. It's also a really big signaling factor to how your brain signals those connections and those neurons for proper function. So if you have a low functioning thyroid and low thyroid hormones, especially that T3, it is going to create that brain fog, that anxiety, those mood changes. And here's where it gets really tricky, is you might know that you have a low functioning thyroid and you're probably on a thyroid medication. Well, those thyroid medications only make the synthetic form of T4, and most of the things we know about what the thyroid does to your body requires it to be T3. So if you're on that medication and you expected starting it was going to change your life and you were going to have, abundant energy and drop the weight and you were going to get all the clarity of your thinking again, and you didn't, it's probably because your body is not able to convert those hormones well, and that's an entirely different issue that unfortunately those medications are not going to help with. So if the only testing you've done for your thyroid is a TSH and a T4, which is typical, you are missing the boat. We need to see if it's converting to T3. We need to see if there's any destruction or interference or any other things going on with that thyroid that's creating that brain fog, because it is one of the main reasons I see with people who are struggling with that inability to really have that clear mental focus. So if you have not had a good full thyroid panel, I would absolutely start there.
And for the women out there watching this that are dealing with that, you're not the only one, right? Because most of the time that's the case.
Absolutely.
You're diagnosed with hypothyroidism, you're put on medications, you're told to come back in 3 to 6 months to get those levels checked. They may change the medication or whatever, but still, the symptoms are still there, right?
Yeah, and sometimes they don't even recheck your levels. The majority of people I meet with is, I got put on Synthroid 15 years ago. They've never really rechecked. I keep showing up. They keep refilling my prescription. We just keep going down that same pathway, and they're never looking for what other causes there might be. So if you have, still symptoms even though you're on a medication, or maybe you're not on a medication yet and you don't want to get there, definitely some good thorough testing helps diagnose that properly.
Again, guys, our motto here is we don't guess, we test, right? So you really need to be tested properly. And guys, we can confidently say there are just no doctors out there, unless you're part of the wellness way, that test as thoroughly as we do and get the clinical results that we do. So guys, another thing I want to talk about is food allergies, right? So, excuse me, there's a lot of you guys out there that are eating well. You're eating your vegetables, you're eating your fruits, you're eating good, lean, grass-fed meats, but yet you still have these inflammatory processes going on. And guys, you really need to get your food allergies checked, because the things that we look for, we're going to run 2 different types of antibody tests on you, and we run over 125 different foods. And what that tells us, guys, is it tells us that when you eat certain foods, there's either one of 2 things that you're doing. You're either poisoning yourself or you're feeding yourself nutrition. And unfortunately, there's really no in between, right? And so if you're allergic to a food, even if it's broccoli or cauliflower, if you're allergic to that food, when you consume that food, your body sees that food as a foreign invader and not as nutrition. And so it will do whatever it can to try to remove that from your body, just like it would a virus, a bacteria, a parasite. And so with that, you're going to get a lot of inflammation that develops, and that inflammation is going to want to go to your brain. So food allergies is a big one that that needs to get tested.
I just want to say hi to everyone popping on. We have Amanda and Ruben. Ruben, I'll see you. We'll all see you this weekend in Atlanta.
Yeah.
Justin, Josh saying we're crushing it with some good value. Well, that is what we hope really for you guys with these videos, is bringing you content and value. Because I know there's a lot of information out there and a lot of places you can go. We want to make sure we're bringing you factual, up-to-date, really good information that you can start using in your life. So I appreciate you saying that. And Nancy, Fancy Nancy, she's one of my favorite people.
Fancy Nancy?
Love me some Nancy. We'll see her this weekend too. All right, so back to brain fog. So we covered that maybe you have some food allergies, especially diabetics, but anyone who has elevated blood glucose, that's going to create some of that brain fog and that inflammation. The next thing I want to talk about, and this is a new one for kind of our generation, but it's EMFs, it's electromagnetic fields. It's the things that we're surrounded with. So never before, not even us growing up as kids, you had the dial tone. Remember getting on the internet and it was like, and you had to wait and then plug it back in. We didn't have any of this stuff. But now we're surrounded by Wi-Fi and Bluetooth and all these meters and all these things that we just take for granted because we love the convenience of them, but it's creating an imbalance in our environment, and it's actually really, really hard on your energy and your neurons and the way that your brain is physically functioning. So just be aware of those things. I know it's funny, I always felt this way and I never knew why. Anytime we would go in somewhere like Best Buy or Walmart or in the electronics section, I would always get really dizzy and really weak, and I was like, I just don't like going in those places, and I never put it together, but it's because you're bombarded by all of those EMS all at one time. So we've got to be mindful of those, especially if you work in an office where you guys have Wi-Fi everywhere and there's 15 different computers going, and then everyone also has their cell phone at the same time, and you're just surrounded by it. You need to do something to protect yourself. So there's tons of things that you can get. You can get them on Amazon, you can get them online. One of my favorite products, it's called Q-Link. We actually just got one for our entire family. You wear it on a chain, but it helps protect you from some of those EMS, helps kind of push out that energy that you're not absorbing it so much. There are things that you can put on the back of your phone to protect you. There are things that you can put in your house. Just make sure you're being mindful of that, because it is a real thing, and they're actually showing now that the damage that those EMS have, it typically takes about, or used to take about 20 years for us to feel the effects in our body, because we weren't surrounded by them as much. Maybe it was just a few here and a few there. Right. But they're saying now it's accelerated by almost 10 times. That just being in these environments, we're starting to see physical change in our DNA after just 2 years of being surrounded by those things. And it can come from anywhere. Meters at your house, those big green boxes that are full of electricity that sit, 10 feet from your house. All of those things create those magnetic waves that we have to be careful of. A tip I can give you right away today to start doing is, if you still use a microwave, get that thing out of your house. We have not owned a microwave for, 10 years now, but we also will not be in the same room with a plugged-in microwave. People think we're crazy. We go to a hotel. We're going to a hotel this weekend in Atlanta to meet with our Wellness Way doctors. I will go in there, and if there's a microwave, I unplug it, because just having it plugged in, it is still emitting those microwaves, and they're damaging. They're damaging to our DNA, they're damaging to your food, so we don't have it in our house. When we used to have to rent apartments and then we couldn't take it out, I would unplug it and I would use it to store my cookbooks in. Like, we just don't use them. And then people will say, well, then how do you warm up your food? What do you mean? Use the stove. Yeah. It's going to take you like 3 extra minutes. It's not a big deal. You'll have one pan to wash, but you're not going to get, the cancer and the brain fog and the other things that go along with it. So if you still use a microwave in any capacity, I highly encourage you, today should be the last day. Unplug it, throw it out, get rid of it, or use it as some type of storage unit for your house, because it's not good for you, it's not good for your body, and it's certainly not good for your kids if you're feeding them food out of that microwave.
Yeah, guys, and then take that serious. I mean, that is a big one. A lot of people hear that, and and then they use it every once in a while. Guys, the waves that are put off by the microwave is just excuse me, it's just absolutely terrible for you and detrimental.
We're so crazy that we try to go to restaurants that don't use microwaves. We'll ask before we go. And one time my husband and I went out for a date night, and we went to this cute little bistro place that we didn't expect there to be microwaves. They kind of do everything by hand. We're the only 2 people in there, and we're sitting at their counter, and we're just talking back and forth. We place our order, we go back, and we hear the beep, 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 beep. Brrr. My husband literally jumps up and he goes, Miss, like he's all freaking out. He's like, are you putting our food in the microwave? She's like, yeah, we were warming it up. He's like, oh, we don't want it. Like, no, take it back. Like, we'll pay for it, but we're just not going to eat that. And we take that very seriously. We just won't. We don't compromise on that.
Guys, there's a lot of medications that you're taking, especially the ones that bully your nervous system, right? A lot of statin medications out there, a lot of cholesterol medications, a lot of blood pressure medications. One of the major side effects is like fatigue. They don't call it brain fog, they more call it like confusion, or I'm not even sure what they call it, but a lot of the side effects from the medications that you're taking.
Even when they say things like anxiety and depression or changes in mood, that's
changes
what they
in mood,
mean.
yeah,
That's what they mean.
Yep. So you guys really want to pay attention to that stuff. Again, we address what's causing those issues, and so we see a lot of our patients, a lot of their doctors are taking them off those medications, because again, if we can normalize function in the body, and that's what our job is, guys. You have to understand, we don't treat diabetes, we don't treat hypothyroidism. Our job as a Wellness Way practitioner is to normalize function in your body, because if your body's functioning normally, there's no presence of high blood pressure, there's no presence of high cholesterol, there's no high blood sugar, there's no lack of the hormones in